Myself, Sriram K, Associate Professor in Department of Pharmacology. Today's topic is heart diseases. So previously we have seen all the functions of heart, anatomy of heart. So we move on to the diseases related to the heart. So what are the major diseases that are affecting the heart? So firstly, what is definition? Any disorder that affect the heart structure or function. So any defects, the attacks that affects the structure, that is anatomy or functions of the heart, may be defined as the heart diseases. So this heart disease is leading cause of death worldwide. Okay. So around 18 million deaths annually. So in a year, maximum number is 18 millions happening every year. So what are the types? So there are so many types of heart diseases we can see. So these are listed here. So coronary artery diseases, this is the most common disease. Then arrhythmias, then valvular disease, then heart failure, congenital defects, myocardial diseases, and pericardial disease. So these are the types of heart diseases that we are going to see one by one. So going into the first disease, that is coronary artery diseases. So generally we seen that there are two types of blood vessels. One is artery and another one is vein. So arteries generally carries the oxygenated blood. So that is taking blood away from the heart. So these are called as arteries. So this coronary artery generally it supplies the blood to the heart. So the heart need to function. So that function happens because the coronary artery supplies the blood to the heart. So what is the definition? That is narrowing of blockage of coronary arteries due to atherosclerosis. So the vessels, that is the arteries that takes the blood to the heart, that is blocked. Okay, so that the heart did not receive enough blood to pump. So that is why it is atherosclerosis. The blockage is due to atherosclerosis. That is, it is blocked by the fat buildup, lipids buildup in the arteries. So what is the pathophysiology? That is plaque buildup, reduced blood flow. Okay, so I already told you that it is plaque that is it's kind of a lipids that are built up on the arteries. So this buildup may reduce the blood flow. So this will lead to the ischemia. Then plaque rupture, that is, once the plaques form, then it will automatically get ruptured. So this rupture will form thrombosis. So this is like blood clot within the blood vessels. So this may completely block the blood flow in the arteries. So these are the two pathophysiologies that leads to the coronary artery diseases. So what are these risk factors? Why it is happening? May be related to smoking, hypertension, diabetes, high cholesterol, family history, and obesity. So going into the second, that is myocardial infarction. Infarction, that is, what is definition? Death of heart muscles due to prolonged ischemia. So ischemia generally refers to getting low level of oxygen in the any part of the heart. Okay, so ischemia generally refers to limited supply of oxygen and blood to any part of the heart. That is called ischemia. So what are the diagnosis? How we can diagnose? That is, one is symptoms. That is crushing chest pain. We see the crushing chest pain and radiating to left arm jaw, and shortness of breath and nausea. So that chest pain will lead to the left arm also. Okay, so if the left arm is lightly paining, so we may see that there is myocardial infarction. And also second symptom is easily seen in ECG, that is PQRST waves, in that ST segment is elevated. So ST elevation and other changes, as you can see. Then enzymes. Okay, what are enzymes? So we have a lot of enzymes in the body. So that is, one of the enzyme is troponin. So the troponin level is elevated in the myocardial infarction patient. Okay, so these are the three diagnosis system that we can see. What are the complications? So if we get the myocardial infarction, we may get heart failure, that is completely heart may not pump. and rupture of ventricular valve or papillary muscles, then pericarditis. So these are the three complications. And what is the treatment? That is time is muscle. So you have several type of drugs. That one is aspirin. So aspirin may easily get out of the danger from the myocardial infarction. Nitrates, morphines. So these are all the treatments that are available for the myocardial infarction. Next disease is arrhythmia. So in arrhythmia, we see already that heart beat per minute is 75 according to the normal level. So 75 beats per minute is the normal rhythm. So if anything is more than or below, it will be called as abnormal rhythm. Okay, so that is why arrhythmia generally it says that abnormal heart rhythm. So it may be too fast, too slow, or we cannot say it is maybe irregular. Okay, sometimes it is maybe too fast or too slow. So this is divided into three types. So how they are: tachycardia. First one is tachycardia. So tachycardia in sense it is beating more fast. So we see that normal beats per minute is 75, but here tachycardia generally it refers to more than that, that is more than 100 beats per minute. Okay, so this is called as tachycardia. And next one is bradycardia, that is it beats very too slow, so below 75. Okay, so in bradycardia we generally say that it is below 60 beats per minute, we say it is bradycardia. And irregular it is variable. Okay, so sometimes it may beat fast and sometimes it may beat slow. Okay, so these are the type of arrhythmias. So what are the symptoms? So symptoms we can see is palpitations, dizziness, syncope, and sudden death also it may happen. Okay, so these are the arrhythmias. So going into the next slide, valvular heart disease. So valvular, we already seen that heart contains four valves. Okay, these four valves can be affected. So by stenosis, that is narrowing blood outflow obstructed. Okay, so in case of valves are narrowed, that may be two types. That is aortic stenosis, that is systolic murmur, syncope, angina, and dyspnea. Okay, so all these things we can see. In mitral stenosis, diastolic murmur, okay, that is opening of snap and atrial fibrillation, we can be able to observe in that. Then uh, regurgitation, okay, that is leaking. So in the leaking, blood flows backward. Okay, so if the valve is not completely closed, we can see this. So that may be divided into two types. So in the mitral valve it may be hollow systolic murmur and heart failure. In aortic it is diastolic murmur, wide pulse pressure. Okay, so what are the common causes? Is rheumatic fever, degenerative calcification, and all these things are the common causes. And treatment, medical management and valve replacement. We can easily in surgery we can remove the valve and we can replace the valves. And going into the next slide, cardiomyopathies. So these are disease in the heart muscle. Okay, so heart muscles, there may be diseases. We can see in the three types, that is dilated, that is enlarged or thin walls or weak pump. Okay, so this may be the dilated type, and a hypertrophic type, that is thick walls. So generally the heart muscle will be thick and small cavity. Okay, there is no space for blood. And restrictive, so restrictive means stiff. The heart muscle is stiff and not compliant, it is not easily smooth. Okay, so these are the types. And in hypertrophy, the most common cause is sudden cardiac death in athletes, that is less than 5 years, 35 years also it may happen. And finally the last, I think, there is pericardial diseases. The pericarditis is inflammation on the pericardial sac. Okay, so we see the pericardial layer is the outer layer of the heart muscle. So what is the causes? Varial most common. Okay, viral is most common. Then post MI and deutemia autoimmune. Okay, what are the signs? Pericardial friction rub and ECG. You can ECG you can diffuse SD elevation. Okay, ST elevation level is elevated and PR is depression. Okay, so this is called pericardial diseases. And finally, the conclusion: the heart disease is preventable and treatable. Okay, it is not like it is not like any deadly diseases, but it is some type of dangers. But lifestyle modification, early recognitions of symptoms, and modern treatments can save the patients from the heart diseases. Okay, so as we come to the end of this slide, thank you. So heart diseases generally it is curable and treatable. Only thing we have to recognize it earlier. Okay, if the symptom is clearly visible to you, you have to go to the doctors immediately. Okay, thank you.